The year was 1955. Polio had been terrorizing the nation for nearly 20 years. A man by the name of Jonas Salk was working at Pittsburgh University trying to find a way to rid the nation of this terrible disease. Here, the first polio vaccine was born. The polio vaccine was a frontier of the healthcare industry due to its first-of-a-kind mass vaccinations, worldwide immunizations, and the revolutionizing fundraising methods. The vaccine provided relief for the several epidemics of polio in North America. Poliomyelitis, better known as polio, is a virus transmitted through contaminated food or water or another contaminated person. Polio attacks the nervous system, causing paralysis. One well-known example of this would be FDR, or Franklin D. Roosevelt. He was the 32nd President of the United States and contracted polio at the age of 39. But first, we should take a look at what life was like before the polio vaccine. In the summer of 1948, cases of polio began to pop up across the nation. Children began losing the ability to move their arms, legs, and lungs. Iron lungs, the predecessors to the modern ventilator, were invented to help children breathe. Parents kept their children at home in fear if they went to the swimming pool or movie theater, they'd be at risk of infection.
What I can remember every summer was this incredible fear as the plague of polio descended on the children of America.
Said David Oshinsky, the author of Polio, An American Story. Children quarantined during the summer months, doing their best to avoid the virus. Those who were unlucky to contract the virus spent their days bound to crutches, wheelchairs, and iron lungs.
And I can remember coming back at the end of the summer, and you would see some empty desks, you'd see kids in wheelchairs, you'd see kids in all kinds of paralytic devices, and you realized how lucky you were to survive polio season.
America knew we couldn't stay like this forever and that we needed to find some kind of cure. The March of Dimes began in 1938, started by Franklin D. Roosevelt to help prevent infant mortality due to polio. It relied on not wealthy donors, but the common folk of America, like you and me. The March of Dimes relied on celebrities to help push the movement. Celebrities such as Eddie Cantor went onto radio promoting and spreading awareness about the cause. If every child donated 10 cents, we'd be able to further polio treatment and research and create a March of Dimes all the way to the White House, stated Cantor on radio stations from coast to coast. The response overwhelmed them, with so many letters being shipped to Washington. Roosevelt said during a birthday radio broadcast, "During the past 2 days, bags of mail have been coming literally by the truckload to the White House. Yesterday, between 40 and 50,000 letters came. Today, an even greater number. How many, I cannot tell you, for we can only estimate the actual count by counting the mail bags." There were so many bags, the only way they could tally an estimate was by weighing them on a scale. As the Foundation finished counting, the final total was $18 million, close to almost $400 million in today's money. Now with the funds secured, someone needed to start creating a cure, in this case a vaccination. A man by the name of Jonas Salk stepped up to this challenge. Salk was the director of the Virus Research Laboratory at the University of Pittsburgh of Medicine. He slaved away in his lab for the next 7 years, devoting his life to finding a cure. Though he was unsuccessful in finding a full and complete cure, he did develop the first polio treatment vaccine. After years and years of research and testing, Salk finished his vaccine and licensed it to the U.S. government. Schools began mass vaccinations for their students. "I can vividly remember one day going to school and getting the shot," stated Kelly Foley, a child who received the first wave of polio vaccines. "She injected me and moved on to the next kids like I was a product in an assembly line in an interesting way. My parents didn't know I was getting it until I came home and told them," she said. Years later, in 1962, another man by the name of Albert Sabin created an oral polio vaccine, although Salk's vaccine is most commonly used in the U.S. today. These kinds of mass vaccinations never happened before polio swept the nation. As you may have already guessed, polio is not just a problem in North America. Many other places in the world, such as China, India, and Africa, were plagued with polio. That's when the Global Polio Eradication Initiative was created. The World Health Assembly launched the GPEI in 1988, and it began its journey to polio eradication worldwide. In 1990, the Global Polio Laboratory was able to formally detect wild polio and vaccine-resistant polio strands. In 1991, the last case of wild polio occurred in the Hu region of Africa. In 1994, over 80 million Chinese children were vaccinated, and the Hu region of Africa was polio-free. Campaigns in Europe and Asia were launched as well, and over 143 million children were vaccinated. As of 2016, the first phase has been completed after switching from trivalent oral vaccines to bivalent oral vaccines. Now, how does this relate to the topic? The polio virus was the first of its kind to have these mass vaccinations. The vaccine was a huge success, saving the lives of millions of children, so it's no wonder why so many children were vaccinated. To keep this process as efficient and quick as possible, parents or guardians were not notified about these vaccinations. According to the CDC, polio's vaccination rate for children 24 months and under was around 93%, as compared to another common disease such as measles, which was only around 91%. As previously mentioned, the March of Dimes was created as a way to fund research to combat polio. The March of Dimes was one of the most successful charities of its time because of its unique donation method. Before this, no other charities used such method as asking spare citizens to send change via mail to the White House. Although the GPEI was not the first worldwide vaccination program, it definitely was one of the most successful ones. As of 2016, no major outbreaks have happened worldwide. This shows how the vaccine helped pioneer the health industry in mass vaccination, worldwide immunization, and optimal charity methods. This shows how the vaccine helped pioneer the health industry in mass vaccinations and optimal charity methods. During the time of polio, many people were afraid to live their lives, and although these people were frightened, the polio vaccine seemed to descend from above and provide the relief that the nation needed and help pioneer many new ideas within the healthcare industry regarding funding and mandatory vaccinations.